Hello, and welcome to the Thrive for Life Live. I'm your host, Dr. Alicia Shelly, and I am a board certified internal medicine and a diplomat of the American Board of Obesity Medicine physician. I practice a combination of primary care and obesity medicine in Douglasville, Georgia. And so I've had the opportunity to actually care for thousands of individuals who are suffering with obesity or being overweight and having difficulties with their weight loss. And one of the things that I've noticed is that sometimes people don't have a lot of self-compassion for themselves. Personally, sometimes I may be one that will beat myself up or think negatively of my efforts. And sometimes that can turn into negativity that kind of brings me down the slippery slope and get discouraged in my weight loss journey. I remember I had one patient where she first came to me, we discussed kind of what are her challenges with weight loss. And she shared that a lot of times she feels like she has to do everything right. If she doesn't do everything right, then, she's not going to lose weight. And so I shared with her that sometimes when we have this, what we describe as all or none or all or nothing thought process, where we have to do everything right or nothing at all. And if we don't do everything right, then we're not going to lose weight. When in actuality, if we look at it, even if we did just some of the things right, that would help us with losing weight. And so we discussed what are some strategies that she can use to kind of combat these thoughts when they come up. And the one thing that we came up that worked for her was that she kind of forgave herself for the thoughts and she moved forward. Fast forward 3 months later, she comes back and she had lost a good 10 to 15 pounds. And I didn't mention that this young lady was 70. So it definitely is a lot harder to lose weight as she aged, but she was 70 and she had lost 15 pounds in that 3 months. And I asked her, what was the key to you losing weight? And she said, well, I had to forgive myself. I had to give myself grace for when I slipped up, or if I didn't do something as, by the book as I would have thought, I gave myself grace and it just helped reduce the stress. And I just kept moving forward and was consistent. And so, fast forward, 6 months from now she's lost 20 to 30 pounds and she's in a normal weight. She feels healthy. She feels good. But it all started with her having compassion for herself, forgiving herself for not being perfect, because none of us are perfect. But she didn't beat herself up and she kept moving forward. So let's chat about why a negative mindset, or how these symptoms happen. And so a lot of times, I don't know about you, but many times I may get on the scale and I look and see that it has not moved, or I gained weight. I start to feel discouraged, or start to feel like, oh, is this really working? I have these thoughts, these negative thoughts that are coming into my mind. And in years past, maybe not necessarily recently, sometimes I allow those thoughts to just fester. And before you know it, I've stopped doing the healthy habits that had helped me to lose weight. And you may be in that same boat. I know I've had many patients where, that negativity just kind of brought them down that slippery slope and they just stopped everything. And so, why does this happen is the question. And the reason why it happens is that, number one, we have unrealistic expectations. We feel as if, we have this grandiose ideas that, I'm going to be able to exercise 5 days a week. I'm going to do it for a whole 2 hours. I'm going to eat like a bird. I'm going to have small meals prepared. But we don't take into account that, oh, wait a minute. It's a really busy season at work and I'm working overtime. And so I'm working 12-hour shifts 5 days a week. And I'm doing my best just to get home and get into bed and get up and go back to work. Or we overlook the fact that, oh, my kids have band practice. They have soccer practice. They have drama practice. And I have to take them all these places and I don't have time to cook a healthy meal. So it's important that we look at our expectations and make sure it's realistic for where we are in our life at that moment. Also, sometimes we overcommit myself. And I definitely can attest to that. I definitely overcommit myself a lot. It's hard for me to say no, but sometimes we have to. If we are trying to do not only with taking care of our family, taking care of our work, but then also we're doing a lot of extracurricular activities, maybe at church, maybe a nonprofit, and it's just kind of taking away from what's most important, then like our health, then it may not be worth it. And so it's important that we kind of look at our priorities and figure out what is working best for us. Now, last but not least, sometimes we may be in a bit of a depression or maybe in burnout and due to chronic stress. And we need to address that before it starts to permeate as these negative thoughts. Now, how do we avoid? And the one thing I'll say about negative mindset is that negative mindset can actually lead us down to a place of self-sabotage because of the being discouraged, feeling ashamed of what's going on. We sometimes will say, oh, this is not working, so we'll just stop it altogether. Even though we all didn't really give it a good chance. Maybe give it 1 week or 2 weeks, or because we didn't lose the amount of weight we had already had in our mind, it's no good and we stop. And so how do we avoid that self-sabotage? How do we avoid getting to that point? Well, number one, we need to create realistic expectations, meaning that we need to look at where our goals are and make sure it's realistic for where we are. Like, it's not realistic to lose 20 pounds in a week. It's just not. And if you did, you may gain that weight back the next week. So it's important that we are mindful of what we're doing and then making sure that these expectations are real. Now, I have to admit, I just did in a webinar with Dr. Judy Wright, where she broke down different techniques and strategies of how to prevent burnout and stress. And so I want to share those with you today. And so the second one is to build a positive mindset. And how do you build a positive mindset? Well, you do that by, number one, choosing to think positive. Instead of thinking of all the negative things that can happen, focusing on what are the positive things that can happen. Next, sometimes it's really good to have like little Post-its with affirmations, just reminding yourself that you can do it, because sometimes life is hard and you just need something to kind of remind you that, yes, you can do it. So having some affirmation cards, positive sticky notes that you can put down somewhere so that you can see it and you can remind yourself that, yes, you can do this. Next, engage in regular self-check-ins, meaning that you look to yourself and say, hey, how am I really feeling about this? Sometimes we feel, things happen and we just brush them off. But then when you get in the car or when you're at home, you're sitting there ruminating about it, thinking about, okay, I can't believe this happened. So it's important that you kind of check in to see where you are and then address where you are and then move forward. Also foster healthy relationships. Have people that love you for you and that are willing to tell you the truth. Because sometimes the people who don't tell you the truth are not for you and are not helpful to you growing. So making sure you have those healthy relationships will be key. Next, practice mindfulness and practice stress management, reducing your stress management, because a lot of times with mindfulness, it kind of pulls you away for a minute or two to just relax and just be mindful of where you are and just be able to take that moment break. Because number one, we need that. We need to have a break. We need to be able to take a deep breath and recover, or we're going to go into burnout. Also, it's important to find ways to deal with your stress. If you know that your boss is going to stress you out, you can preempt that and prevent that and have things in place in order to prevent the stress out. Next, I would say create and stick to boundaries. I had one patient, he worked 7 days a week and his boss would call, and whenever they would give him a day off, his boss would call him on that day. And so I was like, well, you don't have to pick up the phone. You can wait and take your time with it and be like, hey, I'm off today. Can I call you back later? You can have like a message. I will be out of the office from this date to that date. Please leave a message with someone else so that they know and you don't feel like you're ghosting them. But it's important to have those boundaries because you need your space. You need to rebound. And by having those boundaries, it will make that a lot easier. Well, I hope this has been helpful for you on how self-compassion will help you lose weight. And I forgot to mention, but when you have chronic stress, it can lead to increased levels of cortisol, increased levels of insulin, which lead to fat deposits. So regardless of what happens, you definitely need to make sure that you are doing those 6 key areas to help with avoiding self-sabotage, which is create realistic expectations, build a positive mindset, engage in regular self-check-ins, foster healthy relationships, practice mindfulness and stress management, and create and stick to boundaries. So I hope this helped. Feel free, if you want to hear more, to check out our podcast at the Back on Track Achieving Healthy Weight Loss podcast, where we share more items and strategies on how you can achieve healthy weight loss. All right, see you next time.